Good morning. My name is Kesari Naidu and I'm one of the exercise supervisors in the cardiac program here at Toronto Rehab. Today we're going to be talking about goal setting. Part of what cardiac rehabilitation is about educating you around your risk factors for heart disease. We've spent some time already talking to you about risk factors and giving you your profile. We've also been exercise training you and in hopes to reduce your risk for progressing heart disease. Cardiac rehabilitation is also about getting you back to normal life, getting you back to maybe things that you once were able to do that you aren't able to do now, getting you back to new activities maybe that you are wanting to try. We're here to guide you and help you towards getting to those types of goals or achievements. You guys are the ones that are going to be doing the hard work. So today we're actually going to be working on choosing one particular goal that you want to work on and determine the steps that you need to do to get there and be successful while you're here on the program. It's not just about trying to come here every week and do your exercise. We want to make it meaningful for you, so by the end of your program you have achieved something and you feel accomplished. While we're going through the next few minutes and going through the slides today, I want you to start thinking about certain questions and how you might answer those particular questions. So things like, what do you want to be doing 6 to 12 months from now? What do you want to look like? What do you want to feel like? What do you want to be doing consistently by the time you finish the program that you're maybe not able to do right now? Really, we're trying to ask you, what vision of yourself do you have that you want to achieve? And by setting a goal, these particular small steps are going to help you towards getting to that overall vision that you have for yourself. So today, by the end of the session, we want you to understand the importance of setting goals. So we're really going to explain what goal is and get an understanding of why it's important to set a goal. We're going to teach you how to set a goal properly, make sure you have the tools and that your goal encompasses a lot of components that will ensure that you're successful. And we also want you to be able to choose a goal that you actually feel ready and committed to working on today. So really, what is a goal? There are many definitions out there of what a goal is, and this one is pretty simple and concise, and we thought it would be perfect for this particular venue. A goal is a specific area in your life that you would like to improve. So it may be around health, it may be around stress, it may be around a particular type of activity. There are many things that it encompasses. Why do we set goals? Why are we spending a committed amount of time to educate you about this and sit down with you and ask you to set a goal? Well, goals can be very motivating. When you're here on the program, we're asking you to change your diet. We're asking you to maybe quit smoking. We're asking you to exercise consistently 5 times a week and hand in diaries. We're asking you to practice stress management. There's a lot of things we're asking and changes we're asking you to make you do. In trying to do this and adhering to this over a long period of time can be overwhelming. So by setting a goal and working towards something specific that's important to you, it can be a motivating factor for you to be engaging in these day-to-day things like exercise and like eating healthy. Goals allows you really to take control of your rehabilitation. Remember, it's about you getting something meaningful out of the program. And by you setting something specific that you are motivated to, committed to, and feel confident about doing, it allows you to take control over your rehabilitation. And it also allows us, the team that's working with you, like your exercise supervisor, your exercise leaders, to individualize and tailor your program specific to your needs and concerns. You're here in a group setting, but as you know, your program is on an individual basis. This allows us to make sure that it's meaningful for you. Goals are a wonderful way to help you measure your progress as well, so that when you do come to the end of the program, you're able to say, yes, I went from this to this and I see a progress and improvement. So it's a great way to measure your progress. There are many types of goals out there, and 2 predominantly types we're going to talk about today. One is what we consider a medical goal. So medical goals really encompass things like, I want to gain better control of my diabetes. I want to lose weight, or maybe I want to take some inches off my waistline. I want to increase my fitness. I'm still smoking and I really want to quit by the time I'm finished the program. Things Things like risk factors, so improving your blood pressure and your cholesterol, maybe stress management and decreasing the amount of anxiety you experience. And maybe it may be around just trying to decrease your risk for stroke. So these are all types of medical goals that we've maybe already spoken to you about. You've already indicated to us in some way or another that, that this is an area you want to work on. And when we gave you your risk factor profile, it was pretty evident maybe that this particular area was of concern and you maybe need to do some work on that. There are also other types of goals, and we call these non-medical goals. So what is it that you want to do that you're not able to do right now? These again are coming back to different types of activities that you might be interested in. Things like playing tennis, gardening, getting back to the golf game, eating better, or even trying to plan a trip that you, to a particular area of the world that you've never been to. It could be that you're not able to socialize with your family or your grandchildren in an effective way because your energy levels aren't as great. So you want to work towards that to make sure that you're able to enjoy them better. These are what we call non-medical goals, and any of these medical or non-medical goals are fine to be working towards while you're on the program. What I want to talk about now, and before you actually start setting a particular goal, is talking about the stages of what we call change. Change can really be a hard thing to do for most people when they try to start a new healthy habit, for instance. Change can be daunting. It can be can be fearful about it. We can have anxiety about it, and it takes time. We don't expect these changes to occur in one day or in 1 month. It does take time. What's nice is for you to understand is how we change our behaviors depends on what we call a stage of change you're in. And what you see on the slide here is a continuum of different stages that you may or may not be in for one particular type of behavior or goal. There are 5 stages, one being the not ready stage, the considering stage, the ready stage, the changing stage, and the maintaining stage. So let's start with the not ready stage, which is the first one. If you are not ready to make a change in a particular area, that's really where you're at. You're not ready. You're in that particular stage. So for example, weight loss. This may be an area that you have to work on to decrease your risk factors for heart disease. However, you may not be ready to even think about the concepts of the steps that you need to do in order to get there. Making changes in your diet, exercise, these types of things are something that you don't want to consider doing at this particular point. And that tells us that you're not ready to even look at making a goal in this area. And so we don't recommend you doing that. The next stage is the considering stage. In this particular stage, you're considering to make some kind of a change in this particular area of your goal in the future. So let's say in the next month or even in the next week, that type of thing. You're aware of the need to make a change. You've maybe already done a little bit of research around there, gotten your bearings about the particular area, and you're maybe ready to take some action in about a month or in about a week or so. Okay? So in our weight loss example, you're thinking about losing weight. You're warming up to the idea, but you haven't made any change yet. Again, perhaps for right now, not the best area to choose a goal on for the purpose of what we're doing today. The ready stage, this is a stage where you are ready to take action on your goal in that particular area right away. You've already done some research, you've maybe spoken to some people in the program or to your exercise supervisor or to family members or other services to help you get the necessary information on taking the steps to making this goal, and you're ready to put pen to paper and setting that goal. This is the particular area of a goal that we want you to work on. So if you feel confident and ready to do it, you are in the ready stage. So when you're thinking today about your goal, this is the action that the stage you want to be in. If you're in the changing stage, this is an area where you're already, maybe you haven't set a goal, but you're already making changes in this particular area behavior. So if it's again the weight loss, you've already started your exercise prescription. You've already made change in diets, and you are working towards getting some results from that. You may already be experiencing some results as well. So you've already made headway with respect to that goal. For today, we don't want you setting a goal in that area because you're well on your way for that particular goal already. So we want you to pick something different. In the maintaining stage, this is the stage where you've been doing all the behaviors to get to this success for that goal. You've been engaging in the activity, you've been seeing results, and you're motivated to keep going with that. And that's the maintaining stage. Again, if you're in this stage, there's no sense in making another goal with respect to the same thing. So really what we want you to do is to be in the ready stage for when you're setting a goal. Okay, you want to take action in the next day or two, put pen to paper, talk to us about what you want to be doing. And this, again, could be around weight loss, it could be around an activity. The choice is completely yours. Remember that a goal properly set, as Abraham Lincoln said, is halfway reached. So now we want to make sure that you set the goal properly. You have the area that you want to work on, and you feel ready and motivated to do it. But now we want to make sure we have the proper components for your goal. So what we're going to do now is take a look at what's called SMART goal setting. It's an acronym, S-M-A-R-T. And each letter in this particular acronym means something specific that we want to relate to when we're actually setting a goal. So the S in the SMART is specific. So we want to write down the details of what the goal is. We want to make it measurable, so M for measurable. How will you know when you've reached your goal? You need some numbers to that. I'm here now, what am I going to be later? How am I going to know I've actually achieved the goal? We want to make it achievable, so pick something that you feel you can actually do and attain. We want to make it relevant. You want to make sure that you're picking a goal that means something to you and not to your spouse or family member or your physician. And we want to make it timely. Give yourself a set amount of time to get the job done. Make sure you don't give yourself too less of a time period and not too much of a time period as well. So let's talk about these items a little bit more specifically. And let's talk about the S, specific. We want to take a general goal and stating it more specifically. So what you want to start doing is asking yourself these types of questions. What do I want to accomplish? Why do I want to accomplish this goal? What are the details of it? When is it going to occur? Who's going to be involved? Where am I going to be actually doing all these types of things? Who do I have to access to ask questions about more information on this? This is about making it specific. So an example would be taking a general goal like weight loss or to lose inches around your waist to making it more specific. And that is, I want to lose weight or I want to lose inches off my waistline. Making it specific to me is really important. So using the word I or I want or I will do really makes that goal specific and making it related to you. It allows you to take ownership over that particular goal. The next one is making it measurable, M for measurable. We want to find a way to measure your progress. So how am I going to know if I've reached my goal? How much? How many? What are the numbers associated with this particular goal? So an example for this would be our goal of I want to lose weight. Let's make it measurable. I want to lose 30 pounds in 2 months. Okay, so I'm going to know by the end of 2 months whether I'm successful or not, whether I've reached losing those 30 pounds. So we want to put numbers to it. The next one is attainable. Your goal should be achievable. You want to ask yourself, is this a goal that I can reach? And am I likely to be able to do what it takes to reach my goal? Have I made it too difficult? Or even have I made it too easy? You want to make sure that it's a challenge. A very good question to ask yourself with respect to this goal is, on a scale of 1 to 10, how confident am I that I am able to achieve this goal? On a scale of 1 to 10, 1 being not confident and 10 being very confident. If you rate yourself on this scale 7 or below, then it tells us that you're maybe not very confident in that you're going to be able to attain the goal. You want to make sure your confidence is 8 or higher on this particular scale, and it's a good judgment to sort of let you know whether you need to readjust or rethink your goal. Okay? The next one to make it actually more meaningful or attainable in this example of our weight loss goal, instead of saying I want to lose 30 pounds in 2 months, when I think about that, my confidence level is probably about a 4 or even a 3. if I take a look at that goal for me to actually attain. So I'm going to readjust it. To make it attainable, I want to lose 10 pounds in 3 months. Now my confidence level has skyrocketed. I feel probably maybe about an 8 or a 9 on this confidence scale to be able to say, yeah, I can do that, and I can do what it takes to achieve that. The next one is relevance. So is it relevant to you? Is the goal meaningful to you? Is this my goal, or is it the goal that my exercise supervisor or my exercise leader told me that I need to work on? Or is it my spouse's goal or my physician's goal? Do I really want to achieve this goal? That's another question you want to ask yourself. And is it meaningful to me? So another very important question to ask yourself is, on a scale of 1 to 10, 1 being not very important and 10 being very important, on a scale of 1 to 10, how important is this goal for me to reach? If I'm rating it 7 or less, then I really need to rethink whether or not this goal is meaningful enough to me. Do I have enough motivators to think about in order to make sure that I'm successful at this? So again, readjust that. And again, making it more relevant, just thinking about it, saying, I want to lose 10 pounds in 3 months, not for my spouse, or not that my doctor told me about it. Think of the reasons why you want to lose that weight. The last one is time, and this is making sure that you've put a specific time limit to your goal, because you could be working on this goal and never ending and not have any ownership to it. So what kind of time frame should I use? Have I given myself a reasonable amount of time to reach my goal? And remember that even though your goal might be a little larger, a longer term goal, we can actually set some short-term goals within that as well to work on it. Okay? So you don't have to be constricted in that sense. So to take our example of our weight loss goal, to make it timely, instead of saying I want to lose 10 pounds in 3 months, to make it even more specific and timely, I want to lose 10 pounds in 3 months and accomplish this by a particular date. So that by when that date on the calendar comes, you're going to make sure that you're going to be measuring things and making sure that you're on a success rate there. An unknown author wrote this. Write it down. Written goals have a way of transforming wishes into wants, can'ts into cans, dreams into plans, and plans into reality. Don't just think it, ink it. And that's where we want to move now in order to be successful in your goal. And what a lot of the research has shown is that if we write it down, we're more apt to stick with it and work towards it. So this form you will be receiving and will be filling out with your team. And it's a way for us to be able to document down what exactly is you want to work on and make sure that is considered SMART: specific, measurable, achievable, relevant, and timely. And then below that, what we're going to do is actually write some maybe smaller, shorter term goals and steps to achieving that overall long-term goal. And it could be maybe getting some information or booking an appointment with somebody, what have you. So this is the form that you're actually going to be using. So to take an example of our weight loss goal that we said, under the goal, under the SMART goal part, we put, I want to lose 10 pounds in 3 months and accomplish this by a particular date. Underneath that, I'm going to put some steps to achieve that goal. So one of the things I may want to be working on, for example, is speak to my cardiac rehab supervisor about the exercise program to plan for the achievement of that goal. So am I on the right exercise prescription to achieve this goal? And if I'm not, what steps do I need to do to get there? So that when you're talking to your team about it and talking to your exercise leader and your exercise supervisor, they will have in mind and keep in mind that this is what your goal is and tailor it towards that. The next one may be making an appointment with their dietitian to find out how you can improve your diet. Serving sizes, spaces on your plate, those different types of things. And so by making that appointment and getting that information is certainly a step. And the last one is identifying the challenges that I've had in the past when trying to lose weight. One of the biggest things that we can do is not necessarily dwell on the past and maybe some unsuccessful experiences, but we can certainly learn from those unsuccessful experiences. So what were the challenges in the past, and what strategies can we come up with to overcome those obstacles that may have gotten in the way in the past so that you are actually successful? And then we can start to implement those strategies. So process for follow-up with respect to this is that your team will be meeting with you on an individual basis or in small groups to really sit down and write down this particular goal. The form that you'll be filling out will be on a double-sided, on a duplicate copy form, so that we can keep ones that we know what you're working on, and that you can take one home with you and put it on your fridge, put it in your office, somewhere where you can see it on a week-to-week basis and know what you're actually working towards and what steps you're doing. And remember that those small steps will start to change as you accomplish those smaller steps. They will start to change and progress through the program. We're going to give you some feedback on the goal as well to ensure that it is a SMART goal, that it's encompassing all those components. And then throughout the program, we're going to have formal check-in points with you to ask you how it's going. So we want you to take ownership of the goal and make sure you're working towards it. But we will be asking you maybe at 3 months, at 6-month marks in your program, where are you with it? And how can we help you and make sure that you're going in the right direction? So that when you come to that time in your goal where you have to assess whether you're successful or not, then we can actually be prepared for that. Okay? And at this point, if there's any questions, we ask you to please make sure that you talk to your exercise supervisor, talk to your exercise leader about it if you're not understanding the whole concept of goal setting, because it can be challenging and daunting. So please make sure that you ask those questions as needed. Good luck in your goal setting session, and we'll talk to you again.